Hello. Thank you very much. Um, Good morning, good afternoon, good evening, everybody. Today we have Dr. Misha, Associate Professor of Psychiatry at the University of California, Santiago, who's also co-director for UC Climate Change and Mental Health Initiative. She will be speaking today to us on climate trauma and community resilience. Um, Dr. Mishra is Associate Professor, as I said, of Department of Psychiatry at the University of California, Santiago. She's a translational neuroscientist and a founder and a director of the NEAT Labs and also co-director of the University of California's Climate Resilience Initiative. Dr. Mishra conducts research on climate trauma and strengthening community resilience. She has expertise in accessible digital mental health interventions and precision psychiatry. Her research has been widely featured in popular media, including featured in CNN, Time Magazine, BBC, World Economic Forum, Scientific American, among others. And she is cited by IDC.
Happens to your body when you eat cheese?
Welcome, Dr. Mishra. This webinar is hosted by me, Dr. Jibril Musa, a psychiatrist and a leadership member of the WBA Conflict Management and Conflict Resolution section. We have also, although we work in trauma, we have also interest in climate change. And our founder, Dr. Elliot Sorrell, who passed in October last year, had strong interest in climate psychiatry. And this session was to honor his name. Thank you and welcome, Dr. Misha. The floor is yours now.
Thank you, Jibril, for the warm welcome. It's hard to see both my slides and the chat at the same time. So if you have questions, please jump in at any time. We can obviously have question and answers at the end, but if there's anything about what I'm presenting at the moment that you'd like to talk about, please feel free to ask a question about that as well. And Jibril, if you want, you can tell me questions from the chat.
Absolutely, I will be keeping an eye on the chat.
Perfect, thank you. So with that, it's a pleasure to talk to you about trauma and building community resilience in the context of climate change. I have the pleasure to co-direct the University of California's Climate Change and Mental Health Initiative, and we want to have a climate positive future, and so I'm excited to tell you about what we're doing as part of this initiative as well. Let's see. And as introduction, as Jibril said, I'm a neuroscientist by training. My own lab's work is beyond the scope of just looking at climate impacts. I direct the NEAT Labs, which is neural engineering, and translation labs, translation meaning we do the work in psychiatric populations and communities as well, and engineer new technologies and tools. So this is like my main bread and butter is this managing and directing the NEAT labs and innovating new technologies for mental health solutions. And I already told you about the Climate Resilience Initiative, which comes from the Mental Health Initiative, and everything we're doing there, you can check it out at climateresilience.online. And I have expertise in study of human brain function, cognition, mental health, especially in the context of depression and trauma, and utilizing scalable neurotechnologies and digital health technologies that are accessible to our communities in locations around the world. The work that I'm presenting you today, inspired by both my past generations as well as my future generations. Pictured here are my father-in-law, Dr. Ramanathan, who is really a legendary climate scientist, winner of many international awards. He discovered greenhouse gases cause global warming in 1975 in a single author science paper that then led to the start of the Montreal Protocol in the 1992, where they were looking at banning greenhouse gases like the chlorofluorocarbons from refrigerants and repairing the ozone layer. And so he's been someone who's been my hero in terms of translating science into policy and practice. Dr. Ramanathan here is featured with my son. My son Ian was 7 years old when we took this picture. He's now 13, like in the picture on the right, and really has been a champion of sustainability for his own generation and inspiring others to have a belief and motivation towards a regenerative future. And Ian has his own book called Listen Up Kids, Our Climate is Changing, and he's passionate about climate education as well. And so we're very excited that we can follow the goals of the climate change movement and climate action across generations together. And so when we in my field, when we look at mental health in general, what motivates my work is that the societal mental health burden is already ginormous. We know from the World Health Organization that in general, we have for 100,000 population, there's only about 10 mental health care workers at best in most places. Sometimes in India, we have, where I come from, there's only about 1 mental health care worker. There's 1 billion people living with mental health disorders around the world. The annual cost of mental health disorders is $1 trillion. And having said that, mental health still has government budget spending of less than 2% allocated. So it's not a priority area for many governments around the world. And what we understand is that when we suffer from climate extremes, then it impacts not just physical health, but also mental health. And climate extremes like floods and wildfires really amplify the mental health burden. And so my work here in this field got started when I started looking at the mental health impacts of California's deadliest wildfire to date, which was the Camp Fire of 2018. And in this wildfire at the time, it was called one of the worst disasters ever seen in the career of the FEMA director. FEMA is the Emergency Management Administration in the United States, the Federal Emergency Management Administration in the United States. The governor at the time says it's so devastating that he doesn't really have words to describe it. It really looks like a war zone. And of course, when people say natural disasters have existed for a long time, what we know now is that the intensity of these disasters, the extent of the wildfire coverage, the frequency of these disasters are actually growing, and we see it more and more, especially in the counties that we live in right here in California. And just last couple months ago, in January, we were struggling in the context of the LA and Southern California wildfires that was just a few miles from our home. And so when we started to look at the mental health impacts of the Camp Fire, which still remains California's deadliest wildfire, we found that there were high rates of post-traumatic stress disorder, depression, and anxiety. The 3 bars that you see here are comparisons between those that were directly exposed to the fires, that is people who had personal loss of some kind, lost home or property, or had family injury of some kind, versus those who were indirectly exposed. Indirectly exposed individuals are those who are in the community but have not suffered personal loss. So they have witnessed the fires in the community, such as the neighbor whose house doesn't burn down, whose family is safe. And those are people who are indirectly exposed, but they can view the damage and the catastrophe all around them, but they're lucky to be saved personally. So those are indirectly exposed, and their impacts and symptoms in that population were also significantly more than those in the not exposed population. The not exposed population in this case were individuals in a community that was geographically distant from this Camp Fire community. So it did not suffer the Camp Fire impacts, but it was age and gender and socioeconomically matched to the individuals who were in the exposed community. And so you see this graded effect, and what is marked here is that the graded effect was measured almost 6 months to a year after the fire actually happened. So it takes time to build local community partnerships, trustworthy partnerships where we can do this research, get IRB approvals, and after this time we're going out into the community. And so even many months after the disaster, we see this prolonged impact on PTSD, as well as anxiety and depression at the bottom graphs here. Overall, if you were to count the prevalence rates of individuals who had symptoms above clinical thresholds, then nearly 35% of community members had climate mental health trauma, symptoms of complex PTSD, depression, and anxiety. So this is a huge swath of the population. We're talking about community-wide trauma in this case, not individual-specific trauma. And this work was widely reported, and in general, the terminology of climate trauma became more and more used in the common public language. There's articles in the press talking about coming of age of climate trauma, and really came to define a complex mental health effects of climate change events. And this was important in some way that we have a separate term like climate trauma, which is separate from PTSD alone because of the causes of this event are different. When we think about PTSD, it first originated from the times of the wars, the Vietnam Wars and others, where PTSD was first started to get defined, where soldiers came back home from war trauma. And of course, there's a PTSD in the context of other kinds of violence, even domestic violence and so on. But this was, in this case, the trauma was really uniquely community-wide, the whole community of suffering. And so the term climate trauma has become more and more utilized in this field. And what's more, we went on to study that it not only impacts the mental health symptoms, but also impacts cognition and brain function. So we work with our community partners to be able to administer brain recordings. This is a picture on the very bottom here. You have a picture with a person with an mobile EEG system on their head. These are systems we've designed with our industry partners, and we made them easy to use so that even community partners who don't have any neuroscientific knowledge or expertise can be trained and learn to use these systems on their own. So we found that there are impacts on cognition, especially in the processing of distractions. It's very important that we are able to process all the distractions that come at us from the environment, because suppressing those distractions is very important for us to pay attention to whatever task we want to pay attention to. So what you'll see here is that directly exposed individuals, their mean distracted processing ability was less. Even so, in the indirectly exposed individuals, both of these groups had lesser distracted processing abilities than the non-exposed controls. Well, we also found that when we did the brain recordings, you will notice that the more intense coloration in the directly exposed brains relative to the non-exposed and the indirectly exposed brains. On the very right here, you can see the contrast between the directly exposed versus non-exposed brain. And what you can see the apparent high intense activity, brain activity, that's going on in the directly exposed brain. And again, this is being recorded 6 months to a year after the disaster has already occurred. And the brain's really in this hyper-aroused state. Such a hyper-aroused state has previously been also shown in the context of PTSD, where really the person's mind really goes into a state of constant scanning of the environment for threat, as if every kind of threat is every kind of stimulus in the environment must be attended to, must be salient, because it could be a threat to one's survival. And so when one is in that mode of hyperscanning, hyperarousal, hyperalertness, then we see this hyperbrain activation as well. And the fact that this has not normalized even a year out after the disaster has occurred can be worrisome and lead to further cognitive disabilities over time. And so we were able to find that this is predictive activity, that people who suffered that recent trauma of the fires had greater frontal activity and versus people who did not have trauma. This parietal activity is also important, and that was frontoparietal networks are highly connected. That's why you're seeing these activations both in the front of the brain as well as on this parietal portion of the brain. If you're not familiar with this kind of a brain map, it's an EEG, a scalp topographic map. It's showing you the voltage on the head, and the reds are the positive voltages, the blues are the negative voltages, the nose is in the front, and the ears are on the side, and the back of the head in the back. So it's like you're looking top down onto the scalp. And so, like I said, this was the frontal activation was predictive of the trauma response. And then more recently, we have a paper coming out that shows that this inability to pay proper attention, to not be able to suppress distractions, can have more complex cognitive impacts as well, such as it can impact the ability for decision making. And again, here also we found the same brain effects, as well as the cognitive effects showed that especially people who are directly exposed tend to have problems with long-term decision making. And so these are the people engaged in computerized tasks where they were choosing from one or two doors, one on one side, one on the other side, and they did not know, but the doors probabilistic related to rewards that would accumulate over time, so would be better for them over time, and so would be related to long-term decision, that would lead to better long-term decision outcomes. You'd get a better reward over time cumulatively if you chose that one door, versus if you chose the other door, you would get immediate rewards, but you won't accumulate them over time. And so the doors were linked with these probabilities so that one was more advantageous in the long term, and that will be the better door to choose if you can track how your rewards are accumulating. And so especially people who are impacted by the disaster, you're very in a state of impulsiveness, you can't pay attention properly, which then leads to not being able to track information over time, and that can lead to this kind of a deficit in long-term ability to track how these rewards accumulate, and then important long-term decisions can get impacted as well. And so to summarize the neurocognitive impacts, we see high distractibility, poor decision making, and this phenomena of heightened hyper-aroused brain activity, which is called the fire brain, and many people refer to it as the fire brain. And I would just clarify that the fire brain can also be a flood brain. It can be found in climate extremes. It's basically traumatically affected brain will show up with this hyper-aroused brain activity. And what I want to point out with this slide is that climate vulnerable communities suffer again and again. So the same region that was affected by the Camp Fire is hit by wildfires every year. It's probably not as intensely, but for some reason there's always fires in this county and also in nearby counties. But this happens to be encircled on the right here. In our area in the state of California, the lighter color here are counties that are the poorest counties, and the counties that already have the poorest health outcome ranks. So these are already counties that have the worst healthcare outcomes, the highest poverty rates. These are people in these counties live at this intersection between the wildland areas and the suburban areas, where land is cheaper, it's right next to the jungle, and they make homes there, and therefore the homes are more vulnerable to impacts of the wildfires as well. And so these communities suffer more than the other more sheltered communities, more well-off communities. So this is definitely, from that lens, an environmental justice issue. So culminating this part about the climate trauma impacts, I wanted to summarize to say that it impacts mental health symptoms, cognition, brain function, and when the term was initially introduced into the literature by Professor Woodbury, who introduced it, it was in his paper, he talks about how psychologically climate trauma acknowledges a circular relationship between humans and the planet. What affects us also affects the planet, and vice versa. And we are the problem in this case of anthropogenic climate warming, and can be the source of solutions. So solutions is what we're going to talk about next. And this, I like this term for when it was coined, is that it acknowledges this circular relationship. And then the last part is that climate trauma adds another layer of disadvantage for the communities that face the worst of climate change and have done the least to cause it. I was talking to you about the climate vulnerable communities. These are the communities that already deal with high levels of non-climate trauma, from the social determinants of health, for high poverty rates, and so on. And this in the literature is commonly referred to as the climate gap, that people who have caused the least to cause the problem are suffering the most, and this climate gap needs to be addressed. And so when we, while looking at these impacts, understanding these impacts also conveying these impacts to others is very important. It's also important to work with community partners to build resilience and address the climate trauma that our community members are facing. So even in our first study, where we had 750 community members participating, we wanted to look at beyond the symptom impacts. What are the personal factors that protect well-being in the context of climate trauma? So this is a plot of regression coefficients of all the things that would predict PTSD, depression, or anxiety. In each plot, a positive value means more risk to the mental health of the individuals, versus in green here, the factors that are in green, those factors refer to factors that protect well-being, that the factors that were higher in people who did not develop the symptoms. So remember that while 35% of community members can have symptoms, the rest of them did not develop clinically meaningful, above clinical threshold symptoms. So when we study the people, not the people, but the whole population, what is predictive of lower symptoms, then greater age is important. It's also important to have personally resilient beliefs. So when people have psychological beliefs that they can bounce back from any kind of stressor, that they can build back, that personal belief can go a long way in protecting oneself from developing mental health symptoms. Especially in case of depression and anxiety, we saw that exercise, so being physically fit, was predictive of better mental health. And then also mindfulness, people who were more in the present moment and did not dwell on past experiences or future experiences, more in the present moment, those individuals were also protected from the mental health symptoms. So overall, these three personal factors promoted well-being. And in another paper, we went on to see that there are social factors that we also make sense in this context that can protect well-being. So in this population, again, people who had stronger family ties and a sense of community, people who said that they strongly connected with their community, had strong emotional support from their family, those people also were resilient to climate trauma, also did not develop the severe symptoms. So it's very important to have a good community and family positive network that around you. So building that is important for our community members. And then post-disaster, we started to look at community efforts that were coming up from the grassroots. We already talked about how mental health care systems can be overburdened. There's already a large burden on on our systems of care to provide for mental health solutions. Of course, those solutions are helpful. People should seek out therapy. People should seek out pharmacological care when they can. But our community workers and their initiatives in the communities are equally important, because that can help to really bring up the mental health and well-being of the population. So in this case, we are working with the ecotherapy programs in these areas that are bringing solutions such as nature connection, nature mindfulness, eco-stewardship towards the community members. And what you're seeing here is a picture of multiple members of the community who went through the wildfire trauma, and now congregating again when it's safe to go back in nature and reconnecting with nature in a positive way. That's very important, because these same people have trauma from exposure to apocalyptic sites of nature. The same nature that was burning a year ago set off these stress responses in their minds and their brains and their body physiology that keeps them alert and constantly on guard for their own survival. And that kind of connection needs to be rebuilt towards a more positive and rejuvenating connection, which is exactly what they're trying to do here, is coming together in groups and practicing nature mindfulness, and as well as learning how they can, in a circular way, give back to the nature that supports them, and to be part of eco-stewardship efforts. What happens in these areas, very interestingly, is that people become stressed out by by efforts like protective burns, when there have to be low-grade fires that have to be burnt in these areas, so that they can minimize the risk of larger fires from happening. But that kind of low-grade burn can really set off a PTSD of a person who's been traumatized by a disaster event such as this. So being able to renormalize that connection, that aberrant neural connection that they've developed with nature, is very important for these community members. And so we continue to work with them, and we find that even a single session, ecotherapy session, can improve depression symptoms, anxiety symptoms, stress symptoms, with measures taken a week before and a week after the 3-hour ecotherapy session that they undergo. This session also improves mindfulness, improves attachment to place, which is again very important. Many people develop a sense of loss of place, or sense of urgency to leave the place that they belong to because of the traumas that they have. And so redeveloping a stronger sense of a place attachment is important, that this place belongs to me, this is where I live. That is very important to as a part of the healing process itself. And so now I want to switch a little bit to not just addressing climate trauma in the context of the disasters, but in general, when we work with our youth in our communities, in our universities, we see that there's high rates of climate anxiety. And so there's a need for building community resilience that goes beyond just working with the communities that have been just impacted by a disaster. And so that's the very goal of our University of California-wide climate resilience course. We have, the UC has 10 campuses all over California. Each of them has, a large population. For example, at San Diego, where I'm at, there are 40,000 undergrad students who come through every year. And of course, it supports a high number of faculty and staff and so on. So the University of California is one of the largest employers in the California system. And like I said, across universities, there's many 500,000 youth that are going through the University of California system in any given year. This is just the undergraduates. And for them, we designed this coursework where, again, you'll see the same sort of semblance of mindfulness and compassion sessions that we do in nature when possible, other times in the classroom. So ways to build inner resilience, understanding what inner psychological resilience is. And for this, we have a unique teaching curriculum where we have a university faculty, such as myself, all partnering with a mindfulness teacher. So every classroom has a mindfulness teacher and a university faculty teaching side by side. And apart from building, working on our inner resilience, students also work on outer resilience, working in their communities. So this is a picture from a climate cafe that is the students from the class, they went out into the community and held climate cafes where other people can come up and talk about their climate related emotions and process those emotions. And these can be very complex emotions. They can range from how I'm feeling now, from the state of the world now, to questions even like, do I want to have children? Do I want to bring up children in this world? And so all of these questions that are personally important come up in these kinds of mental health processing sessions. So this is one example of a community project that students did, but there were several other projects. Some people were interested in sort of eco-stewardship. They did projects related to removing the invasive species in the San Diego area and instead planting more of the native species. We know that in California, we have a lot of invasive eucalyptus plants, which smell awesome, but they also burn up like candlesticks. And so they're not very fire safe at all. And so having vegetation that is native, which is actually more cactus plants, that can prevent from future fires as well. So some people did projects on that. Other people did projects related to clothes recycling and reuse, and other people organized cleanups in the community, and really generating movements where they can make other people more aware about climate impacts and how to resolve them. And so climate action is a key component of the class, and every student engaged in such action, and importantly, had to engage in such action in a collective manner. We understand that individual action is important, but because of the scope of the problem, it is very easy to get disheartened at the individual level, and therefore it's important to build more collective movements. So we have a paper that actually is just in press, just got accepted today, and where we showed in this paper that the impacts of the class were very positive. It reduced pre to post, and now we also have follow-up results 6 months out. It reduced climate-related anxiety, also depression and general anxiety, as well as stress in these youth that we trained. We had about 200 youth who did the first initial course last year, and we're running the course again this year. And then positive factors that were enhanced by the course included improvement in collective efficacy. That collective efficacy is this psychological concept of we can work towards solutions together. If we come together as a collective, we can solve hard problems. So that belief is very important for individuals to have when taking action, especially climate action that can be a huge problem. So collective efficacy went up. They could deal with their climate-related emotions better, and they could connect with nature better as well. And so what I really want to end with here is telling you that when we think about the core priorities for building societal climate resilience, mental health should be considered as one of the core priorities. When we talk about climate resilience in general, we talk about mitigation efforts, such as when we build greener environments in our cities, and our urban design is better and more amenable to protecting the health of the people, then those efforts protect well-being as well. And so protecting ourselves from future risks brings co-benefits for mental health. Similarly, when we think about adaptation efforts, which are very important in the world that we live in today, thinking about relief efforts after climate disasters, the earlier those relief efforts address mental health, the better the outcomes for the community will be, and the community would not have long-lasting mental health symptoms. And so adaptation is very key. And of course, as a central pillar is really societal transformation, where we all believe in the cause of climate action, can take part in climate action. And for that, we need climate education for all, and greater social cohesion. We live in a very polarized society today, and so building social cohesion amongst our communities is very important. Building coalitions and working towards long-term oriented policies that will protect not just the current generations, but also the well-being of our future generations. And so that is my talk, because I wanted to give time for questions as well. And so I come back to my slide initially that I started off with, and I really believe that building climate resilience is an opportunity for all of us to transform this intergenerational trauma that we're seeing in our communities into intergenerational flourishing. It's such a important time that we live in, that we should be really I think it's such a treasure over time when we can think that generations before us as well as generations after us, all living generations, can work towards a common cause. So with that, I'll stop sharing my slide, and I'm happy to take any questions that you all have.
Thank you, Dr. Mishra. I was keeping an eye on the questions. There are no questions for us. I would like to kick the questions and ask you the first question. I'm interested to know what are the impacts of mitigation and social transformation in addressing immediate impacts of climate change effects, particularly when it affects population.
You mean, so like I mentioned, so mitigation is really building environments and that are conducive for our health and well-being, and really showing that when we have cities that are more public transportation oriented or have more green infrastructure, and we can breathe better, we can have better air, we have more renewable energy sources, all of that protects the well-being of the current population. And what we're seeing in our communities is that we need to have better disaster preparedness plans. There's lots of studies that have shown that adaptation efforts are very important for protecting mental health post-disaster. And so developing those kinds of plans is with community stakeholders is very important. Sometimes these plans exist, but community stakeholders know nothing about it, which is something that happened in LA, in the LA wildfires as well. And even today, there's not good plans even even when people think about California being, a climate forward state in the US, even then the communication across agencies, and there's a lot of great, even though there's a lot of great work happening in agencies, the communication across agencies is still not very good and needs to, be brought up better. Did I
Thank
answer
you,
your
the
question?
commissioner. The question was in this line.
Okay.
Yeah. And can I request everybody if you can open the your cameras and then we can have a group photo if you would like that. That would be nice. Then we could share. And I will send a
Sure.
copy to Dr. Misha.
That sounds great.
Dr. Misha, thank you very much for your presentation. This is very important as a psychiatrist. I also have, I cannot show him now, he's eating, but a 3-month boy that is coming to the world, like in a big city, there's a lot of pollution. What future is for the baby? With us, I hope the best. But my question is, many people here are early career psychiatrists, maybe some trainees. So what advice would you have, like in terms of evidence-based interventions or advice or whatever we can do from our perspective of us as clinicians, researchers? Thank you.
Yeah, thank you for your questions. Congratulations on your young baby, and I'm sure he or she,
He.
Okay. Well, I'm sure he'll have a great future ahead. I think for our children, especially, we believe that hope stems from really showing that we're all part of a collective together and that we can solve challenging problems together, and going through hard things together and working towards solutions very important. This is the perspective we try to convey to our youth and our children that we work with, and children in our families as well, that resiliency is work of people across generations. And then for our practitioners, it's very important to really know these impacts of climate trauma, that it can affect mental health symptoms, brain function, cognition. And sometimes for the patient, it's even that acknowledgement is very important. So sometimes people from communities, they write to me and say, like, thank you for writing this paper, because now I can take it to my doctor, who didn't even believe that this kind of symptoms can occur from having witnessed the wildfires. And so a greater awareness is important. And we also know that current psychiatric care works. Like, if the person has access to current psychiatric therapies, that works in a majority of cases. So encouraging people to get a mental health care access, removing the stigma around mental health care access, all of that is very important. And because we understand that mental health resources are already quite burdened, therefore community work also becomes important. And so in community work, it's not that there's a one-size-fits-all solution. I know that there are solutions that have come out of Africa that are different, in that, sometimes the elderly in the communities would offer a place where where others can come talk to them and process their emotions together. And